Okay, good afternoon, everyone. Today we have a very important event, and we are bringing awareness to a very deadly disease, sickle cell, and we're also promoting the importance of organ and tissue donations. Today you're going to see a remarkable story about a very young organ donor and how he saved his brother's life. But before we get into that, I want to, first of all, thank MPP Frank Cleese for providing not only this room, but also the committee room where we're going to do our ceremonies. I also want to acknowledge some of the members of Step by Step. And beside me to my right is our chairperson, Constable Ojo Tiobati, and we also have our vice chairperson. To my left here is Sabrina Kogan. And I also want to thank the Canadian Armed Forces and the Toronto Police Services for joining and assisting us in this very important event. We also have the privilege of having a very famous doctor with us, and that is Dr. Adam Gassis. And he is to my end at the right, and he'll be speaking very shortly. I just want to make a few brief comments. Daniel Badmus is a 5-year-old boy who gave his younger brother, John, an early Christmas gift, the gift of life. Throughout his 4 young years of life, John Badmus suffered with a lot of pain. His family suffered with him, sometimes feeling helpless. John Badmus was afflicted with the deadly disease, sickle cell disease. This disease targets mostly the black population, but also the Asian and Mediterranean races. It is unclear how many people are suffering in Canada, and it is important for us to explore this. There is hope. Bone marrow transplant. On October 24th, 2008, John Badmus' brother, Daniel, donated his bone marrow to save his younger brother's life. This procedure was the first of its kind performed in Ontario. The transplant was a success, and both John and Daniel are doing well. In an effort to bring awareness to this deadly disease, sickle cell, in an effort to inspire Canadians about the importance of organ and tissue donations, Step by Step, the Canadian Armed Forces, Toronto Police Services will acknowledge Daniel Badmus as a true hero. And now I'll pass it over to Dr. Adam Gassis to talk about he's the famous surgeon who performed the surgery.
Thank you. First of all, I would like to thank Step by Step and especially George Marcello for inviting me to be part of this important event to appreciate and thank Daniel, who has donated his bone marrow, as George has said, or stem cells to his little brother John to cure his sickle cell disease. There are more than 30 million people worldwide with what we call sickle cell trait, which is a mild form of the disease. However, what John had is the full-blown sickle cell disease, so it wasn't mild, it is severe form of the disease. What he suffered from was recurrent pain crisis, infections, chest complications, and reduced blood supply to many vital organs of his body, including the kidneys and the brain. And John has suffered a stroke before he was 2 years old because of these complications of sickle cell disease. Hence, he was started on regular transfusion program, meaning every 4 weeks or every 3 weeks he received blood transfusion in hospital in an attempt to wash out the bad sickle cells from his blood so the blood will flow easily. But he would have to do that all his life and may suffer further complications because of these regular transfusions. Bone marrow or stem cell transplantation is the only cure available for sickle cell disease. And John is very fortunate to have Daniel because Daniel is healthy and does not have sickle cell trait or disease, and he's a perfect match to John. Bone marrow or stem cell transplantation is a relatively new science, and since the first successful bone marrow transplantations in humans in 1968, the numbers of transplant has risen dramatically, and there are about 10 million people who are on the unrelated registry who are willing and able to donate their bone marrow for many other diseases. We, in Sick Kids Hospital, perform about 50 to 60 of these procedures per year. These are complex procedures, and the concept behind them is very complicated. Recovery is slow, and there are risks associated with them. However, most of them are successful and save children's lives. John is the first child, as George mentioned, with sickle cell disease who received transplants in Sick Kids. We think he's so lucky to have his brave brother as a donor for his stem cells. It is, however, early days. After transplant, John is only about a month and a half from transplant. He is doing very, very well so far, and we hope that he will continue to do well and his disease will be cured completely. Thank you.
Thank you very much, Dr. Gassis. And now we'll have a few words from the chairperson of Step by Step.
Yeah, I think it's very important to keep in mind that one of the things that Toronto Police does is to divert the attention towards the Camp Jumoke. Camp Jumoke is a special camp where kids with sickle cell goes because these kids cannot be left to do what the normal kids would do on a day-to-day basis. So in order for them to be able to go to these special camps, we have to have doctors and nurses and special aid workers to go with them. So what our Toronto Police have done in the past and still doing is that Deputy Chief Kate Ford and Staff Superintendent Peter Slowly, who is sitting right here with us, and many other police officers have organized a walkathon every year to raise funds. We have to understand that as it is right now, Camp Jumoke or sickle cell, as a matter of fact, receive very, very little, if any, funding from the government. So it's mostly self-help. So which is why we have to organize the Camp Jumoke walkathon every year. And as a chairman for the step-by-step organ transplant, when I came into contact with the father of Daniel and heard the remarkable story, myself also still waiting to give my daughter one of my kidneys, but my daughter has been doing well, so the transplant hasn't been approved yet. So I have a little bit of stake there. So I spoke to my CEO and says, well, we should bring this as part of our awareness to the public to let them know what we are doing, either through Toronto Police, Camp Jumoke, the walkathon, and step-by-step organ transplant, which is exactly why we're here. And I'm sure that at the end of the press conference, the armed forces will be making some sort of presentation to our hero, Daniel.
Thank you very much. And finally, we're going to have Daniel's dad, David Badmus, Mr. David Badmus, say a few words to conclude this part of the event.
Yeah, I want to thank you guys all for coming, and I want to thank George as the president of Step by Step. It's very traumatic to have a child with sickle cell. We started the journey after 6 months of giving birth to John, and it's like every now and then we are in the hospital, and we thank God that we got to the end of the road, and we are starting afresh all over again. And I want to thank Dr. Garcia and his team, and also on the sickle cell side, Dr. Kirby, Dr. Williams, and their team as well, for taking care of John all this time. And there's something that I noticed, like there's this organization called Camp Jumoke. They normally organize this walk every year in downtown. And next year, there's going to be a walk in Eglinton, Oakwood area. And the tentative date is June 22nd. The essence of this work is to create awareness and also to raise funds for research purpose, because a lot of work needs to be done by doctors like Dr. Adams here, in the area of sickle cell, how to apply the bone marrow transplant to a sickle cell disease. And also there are some medication as well that, that were approved in other jurisdictions or other countries that for some reason, which even to some doctors they don't really understand, Health Canada has not approved this medication. They could help these kids if appeal could be made to them so that the necessary approval could be put in place so they can start enjoying what people are enjoying in US and Europe. Thank you very much.
Thank you very much. And so now comes the questions from the media, and you can direct them to each of the members up here.
I'm just wondering, now that John's had the transplant, when you talk about how bone marrow transplant is the only cure, does that mean he's cured, or what's his life going to be like from here? Where does John go from here?
So what happens in sickle cell disease is that his blood-forming system is defective, and that's why he cannot make proper blood or proper hemoglobin to carry oxygen to his tissues. And the stem cell or bone marrow transplantation is a procedure that we ablate his blood-forming system and give him his brother's forming system. It's a very complex procedure because to do that, you have to kill his immune system in order for him to be receiving his brother's new cells. So far, we did the test, and John has all his blood-forming system from Daniel. So yes, his disease has been cured. However, it is early days. It's difficult to say, will he continue to maintain Daniel's blood? And we hope he will. And if he will, then yes, his disease will be cured completely, and he will make a normal hemoglobin and normal oxygen carrying capacity.
Why has this never been done before? Why is this only the first time? If you said the first type of transplant was 1968, why did it take until now?
The transplant itself, as I said, we do about 50 or 60 of them every year for other diseases like leukemia and cancers. There are about 500 people with sickle cell disease around the world that have received transplant. So, but in sick kids, it was the first one. The reason being, you have to have really severe sickle cell disease in order to go for transplant, and most importantly, you need a very good donor. And unfortunately, the people who are in the past did not have a full match healthy donor like Daniel, and we'd only consider family-related donors for sickle cell disease.
So when you're talking about him being able to possibly be fully healthy now, so would it? Oh, sorry. When you're talking about Jonathan being healthy now, would he be able to, if it all, it's early days, but if it all goes according to plan, he'd have a normal sort of healthy life, or would there still be complications?
Well, the complication that has already happened, it's happened. So John has suffered a stroke, so he's weak on one side of his body. With rehabilitation, this will improve. However, we are stopping the progression of the disease. So the disease caused damage to the blood vessels, to the kidney, to the brain, and from now onwards, because he can make normal hemoglobin and normal blood, that disease progression is stopped. But as I said, the challenge is that to continue for him to have Daniel's blood system in his body growing, and so far he's doing that.
His prognosis without the transplant?
That's a very good question, and if you read the literature, the median time for a sickle cell person to live is about 40 years. So if we think that the life expectancy in Canadian population is about 80 years, somebody with sickle cell disease will live about half that life. Now, there are some early indicators for children who have very severe disease at a very young age. They might have even less life expectancy, and John is probably one of them because he had a stroke at an age of less than 2 years. But hopefully with the new bone marrow that he has, this will not be an issue for him.
Are there any implications for Daniel, for his health, or would he be okay from now on?
Not at all. I mean, Daniel is a healthy donor, so what we collected, his stem cells or the bone marrow, he will regenerate that in few weeks and as you can see, he bounced back to be normal and go back to school. So there's no implication, apart from immediate implication of the anesthesia and some pain involved, but no long-term implications on the donor.
Talk about the significance of this procedure and the precedent it sets, or what it might mean for future kids who are like John.
I mean, as I said, this procedure is indicated in severe sickle cell disease. The difficulty is finding a family-matched donor for them. And if there is a family-matched donor and the patient, like John, has a reasonable organ functions and we think that he can pass through the test to go into transplant, we will consider that, and we do that all the time. But we have to be careful about prioritizing patients, because this procedure was mainly invented for leukemias and cancer, and we are using it to treat a disease that is not immediately life-threatening. The first child in history who had sickle cell transplant was actually a child in late 80s or beginning of 1990s who had acute myeloid leukemia. But coincidentally, that child has sickle cell disease. And when they did the bone marrow transplant to cure the leukemia, she was cured from the sickle cell disease. And that was the first case reported.
Considering, other parents watching, seeing this story, whose children suffer from sickle cell disease, does this give them more hope, or would they have to find that perfect match? Is this kind of a one-off? Like, I'm just trying to sort of the future of this type of transplant at your hospital.
No, certainly, it will give them more hope. And, as I said when I talking a few minutes ago, that the number of transplants has increased because we understand better the complication of transplant, and now we have better medications and better disease control. So I think it gives more hope, but the limitation factor is to find a good sibling, a brother or a sister, that doesn't have sickle cell and is a complete match. And only 25% of family siblings will be matched to a potential patient.
So no one watching could say, try and donate to some of these children. It has to be a family match?
So far, the main transplant for sickle cell disease, it has to be a family match. You have to weigh the risk and benefit of the procedure. And if we use unrelated donors, the complications is quite severe, that you might think you probably haven't done the right thing by correcting the sickle cell disease, but you have created other complications that could be life-threatening.
Is he on any medication, or does he have to be on medication now that the procedure is finished, completed?
Yeah, correct. I mean, John is on medication. He is on some medications to suppress his immune system to an extent that he will get used to the new cells. It's like an organ transplant. Bone marrow and stem cells are clever cells, and if they are, if you don't suppress John's immune system, he will reject them. So he's on medication for that. And also, we have to look at the other side. John's stem cells could fight. Daniel's stem cells could fight John's body inside his body and cause something we call graft versus host disease, which is something that we don't want to happen. That's why we have to suppress the immune system for the first 6 months of transplant to make John used to the new cells that he has, and also to prevent graft versus host disease. At the same time, John's risk of infections is high, and that's why I'm sure Dad knows, and that John is not allowed to mix with a lot of people at the moment because his ability to fight infections are not very good.
If I can ask, I guess in terms of step-by-step, what do you guys hope, I guess maybe it's a bit similar question, but what do you guys hope that people will take from this story? I know that there's, obviously there's always the issue with organ donors, also like there's mention of funding issues. I mean, what are you hoping people will take away from today?
Well, it does come into our mission, which is to promote the importance of organ and tissue donations bone marrow is a tissue, and as Dr. Gassis was mentioning, if the person is suffering from sickle cell, there would be a lot less risk if it was donated from a family member. So the public can take that away. If they, people, kids, adults that are suffering now with sickle cell disease can come away with the knowledge, knowing that so far this transplant has been successful, that it could be performed again under the similar circumstances. So that is very important, because as Mr. Badmus can testify, at one time he was probably losing hope, and how much pain John was going through, and now this hope can be delivered to many people right across Canada. So it is very important, and it is something that falls within our reign. If there isn't any more questions, what we're going to do now is proceed to committee room number 2, which is around the corner. And it is in committee room number 2 that Daniel will receive his famous medal. And
Thank you.
And Dr. Thank you, Dan. And as you can appreciate, Dr. Gassis is very, very busy. We're very fortunate to have him here. I don't know if he can join us during the ceremonies.
I actually left John receiving transfusion back
Okay.
at the clinic, so I will go.
Okay. Okay.
Thank you.
Thank you. So we'll proceed to committee room number 2 right now.